Hey guys, Jexie here. Welcome back to another video. So I want to give a warning. As you can tell by the title, this video is going to be a little bit harder to watch, I think, than some of my other ones. It's kind of emotional for me to even record, so I just want to put like a trigger warning out there. If you are sensitive to what other people say about drug addicts, you may want to skip this video today. Okay, so before we kind of get into what I want to talk about, I want you guys to just take a minute and I want to give you some examples and I want you to really think about how they make you feel, right? So let's say you heard a story about somebody who, died of cancer. Or maybe that person who died of cancer chose not to go to their last chemo treatment that could have helped them live a bit longer. They didn't do that and they died. Or how would you feel if you knew somebody who was diabetic and they ate a piece of chocolate cake and it caused them to go into a diabetic seizure and it killed them? Or, somebody who didn't have a driver's license and they get behind the wheel of a car and, they crash the car and they die. All of these situations, we feel some sort of empathy, right? We feel badly for the person, especially the ones with the diseases, right? Maybe the car accident one wasn't a good example, but I like using diabetes the most because diabetes is the one that is a good example of a disease that generally requires chronic maintenance to keep the disease in check. And so, but very often, we know people who have a chronic disease who maybe make a bad decision. And that one bad decision, whether it's their fault or not, can cause them, lead them to death, right? And as a society, we come together and we feel badly and we want to help the family and we're empathetic, right? Now I want to ask you, how does it make you feel when you hear that a drug addict has overdosed and died? It's not the same feeling. At least for a lot of people it's not. And the reason I'm bringing this up is in a couple of hours I am going to a memorial service for somebody I knew since I was very, very young, who died because of this disease. The specifics don't really matter, and this is one thing I think is important for anybody watching. When somebody dies at a young age and it's not in a car accident and they didn't have any, medical issues and they have a history, it's probably from an overdose. But even if it weren't, right, it doesn't matter. The fact is they're gone too soon, right? That's what's important. But whenever somebody dies from drugs, it brings up conversation, right? And it's the responses that people give or the way that people talk. I'm sorry. It's very hard for me to talk negatively, but I think it's a really important topic. So there's two different things we're going to discuss. The one is the response from addicts, and then we're going to discuss the response from non-addicts. So unfortunately, I think, and I'll speak for myself, we see a lot of overdose deaths, a lot of them. And I think part of being able to manage day to day without that sadness weighing us down is we become a little cold to it. We kind of are like, oh, there goes another one, right? When really we shouldn't be looking at anybody's loss of life as just a statistic. But unfortunately, because overdose deaths are so high, that when you're in any sort of recovery program, with the statistics being what they are, you're going to see people die on a fairly regular basis, which is awful. So there's certain deaths that may hit you harder than others, right? A lot of times as addicts, we also seem to get angry at those who aren't doing well. Because we've gotten recovery, right? And we're doing okay ourselves. We seem to forget the struggle sometimes. And I'm saying we because I don't want to say you, right? Because I think we all have different feelings. So by using we, I'm acknowledging that this isn't those people saying something wrong or this group doing something. Like, no, we all have different feelings, right? But I've seen even people who are addicts say, well, you know, they knew where recovery was. They had clean time before. For me, that's really difficult to hear because although that's true, right? Somebody who has found recovery at one point in their life knows where to go again for help. But that still negates the fact that addiction is a disease, right? And a disease that affects your brain, right? This isn't a disease that like affects any other part of it. I mean, yes, it does, but the core of the disease is the way it affects your brain. Addiction is a disease that essentially makes you feel like you don't have a disease, makes you have bad choices, right? And so like it's not to say everything is excusable. And I've explained this in some of my other videos. But the best way to describe how an addict feels in active addiction, the best way I can describe it to you, is let's say a using addict is in the desert and they're for 3 days they're walking through the desert and they're in withdrawal and they have no water, right? And at the end of day 3, they come to a tent and on the table is a glass of water and drugs. Do you know what they're going to choose? They're going to choose the drugs. Not because it feels nice, not because they want to get high, but because their disease, the disease of addiction, will actually has changed the chemistry of our brains, where it tells us that what we need to survive is the drugs, not the water, right? That's a very scary concept and something that's very hard for people who haven't been through opioid addiction specifically to understand. My brain will tell me that if I don't take those drugs, I will die. It'll make me believe that so much more that if I had to choose between the drugs or the water, it's not even a question. So even if we have recovery, if we relapse and we go back out to using, our brains snap back into that addiction diseased mindset. We're no longer thinking rationally, we're thinking as addicts. And I think we forget that. You know, look, the fact is that although relapse is not a prerequisite for recovery, relapse is a part of recovery for many, many people. There are very few people who make a decision to get clean and stay clean for life without any issues again. It's not common. It's not to say it doesn't happen, but statistically, it's a unicorn. Unfortunately now, with the fentanyl and most of the drugs, your first time using could kill you. So now we're at a point where people who are experimenting with drugs for the very first time are dying. Some people may even be dying from drugs that were like considered nothing years ago, like marijuana. You're buying marijuana on the street and it's laced with fentanyl. So the first time you smoke a joint, you overdose on opiates. That's insane. And I think what we need to remember is I get very tired going into the non-addict responses to overdose deaths. And that I have some things to read. But so many are like, well, you know the risks when you start using. But like, do you? Because I don't know about anybody else. But first off, a lot of times people's first time using alcohol, drugs, anything, is when they're in like barely teenagers. You're telling me that at 13 you really understand the full gravity of any decision you're making? Of course you don't. So to say you should never have picked it up, well, that's fine and dandy. But let's be real. I want you to really think, have you or anybody you know never tried anything, never tried alcohol, never tried pot? The second part of people who tend to get addicted are people who were prescribed pain medications for legit reasons, like surgery or some other sort of trauma where they needed those medications. Unfortunately, because of the way opiates work and the way that they impact the brain, they became addicted. Oftentimes, the doctors who prescribe those medications are not really well versed in addiction. they assume if their patient has become addicted to these medications that they've done something wrong. They usually cut them off and kick them out of the practice. And now you've got a person who's addicted to opiates who has no idea what's going on except for the fact that they're sick. And their brain is telling them if they don't find opiates, they're going to die. Now, that person may not have any idea why they feel that way, but they're in survival mode at that point. It's the only way to describe it, right? Most addicts don't want to keep using drugs. It's not a want. Our brains have told us that we have to. And if you've never experienced the changes of if you've never had any sort of mental illness or anything else that changes the chemistry of your brain, then you really can't imagine what that's like. So, just out of curiosity, to make this video, I went on Facebook and I just looked for stories about overdoses. And I read through the comments and I pulled some things out. And this is where I think it could get hard for people, especially those of us who are addicts. These words are hard to hear. Most of the time they're ignorant, and because people who are so ballsy to say these types of things generally just don't understand how addiction works. So, sorry, my hair's being crazy. So I'm going to read a couple of these. And what I'm not going to do is I'm not going to post them on my screen, and I'm not going to call out their names, because my hope is that somebody in their life has seen those posts and spoken to them personally, and that they no longer feel that way. Because it's very hard for me to believe that anybody could be this hateful in their heart. So this was actually a Reddit post. It said, "I have no sympathy towards people who die of overdoses." And then he writes, "I believe that people who die from substance overdose do not deserve sympathy when they die. Of course, there are people who tried to better themselves by going to rehab, but they should not have tried substances to begin with. And yes, I do feel sympathy towards the people they leave behind, parents, friends, etc., but I do not feel any sympathy towards the addict themselves. I hold this view because I believe that if you have no self-control over yourself, that trying any addicting substance is only setting yourself up for disaster, and one should realize the extent of the damage they are doing to themselves and to their loved ones, especially with the amount of knowledge we have on drugs and how addicting and life-threatening they are." Well, sure, maybe that sounds all fine and dandy, but when he says here, if you know you have no self-control, addiction is not about having no self-control. Addiction is about chemicals in your brain being altered. It's not about like, oh, I can't keep myself from shopping. Like, no, my brain is telling me I have to do this. And nobody knows that they are an addict before they have addict tendencies, right? Like, how do you know you're addicted to drugs if you've never tried drugs? To me, that's the most ridiculous thing I've ever heard. And I guarantee you that the person who wrote this probably drinks, probably does something else, and is like, well, I know when to stop. I have self-control, so it must be a problem that you have. See, that's the problem. People don't necessarily look, because when he says, like, oh, there's all this information and knowledge out there. Well, yeah, but this is a perfect example. Had he done any research, he would have realized that addiction actually changes the brain chemistry, in which case changes the way that a person functions and a person views things. It has nothing to do with self-control, right? But he didn't take time to learn that before sharing his opinion. So what are the chances that a 15-year-old kid who's about to try drugs for the first time is like, hold up, guys, let me check the internet to see how this may affect me 30 years down the road? It's ridiculous. All right, so I'm going to read part of this one. This, I think, was posted on a thing about Narcan, maybe. "I hate to be the person who says this, but if people overdose and die, aren't they stopping the problem? I don't care what race, ethnicity, gender, or religion is of the person who overdoses. The decision to partake is their own, and we should accept that they knew the consequences of their actions." And then it goes on. Do they know the consequences of their actions? Yeah. But part of addiction takes away that ability to stop. Most people who are very bad off in active addiction would want to not use drugs anymore. They probably go to bed every night wishing they weren't addicted to drugs. When people are in the worst of their addiction, they don't want to be addicts. Then there's this one. I guess it was in response to a question, but she writes, since you asked, people who chose to use and abuse drugs or medicine are getting exactly what they deserve. It's their personal choice to start, and they know the risks involved. They overdose, oh well, let them die and end their self-made misery. Stop the constant despair and emotional pain they are causing their loved ones. And then there's two other responses underneath, like in the same comment. One says, let the junkies die. And another person writes, let them die. They made their choice. I almost have no words. Like, I almost have no words, you know? Like, if they overdose, oh well, let them die and end their self-made... Yes, a person makes a decision to use drugs. I 100% agree with that. And yeah, if you've never touched drugs ever, then you probably aren't going to have a problem. But would you say, like, well, diabetics are choosing to eat their chocolate cake, so let them die? Why are we helping them? Why are we going to give them insulin? Right? Like, it sounds ridiculous. Especially, like, if a diabetic became diabetic because they had poor eating habits. Right? You never hear people say, let that diabetic die. Why is it that you say that to addicts? So then, bash my comment if you want, but these people made their own bed, and the taxpayers shouldn't be on the hook to pay Big Pharma for these treatments when the junkies will just continue to OD over and over. The only winner is Big Pharma, who needs to be responsible for their own destruction. Well, okay, I can at least agree with that to a point. Simply saving somebody with Narcan is not the solution to overdose deaths. There needs to be treatment options. There needs to be more awareness about what addiction is. But so many people are against the idea of Narcan because it's bringing back... Do you know that there are actually people out there who believe that addicts purposely overdose so that they can get Narcan and come back and do it all again? People actually believe that. And maybe there's a rare story here and there of somebody who's done it, but I will tell you right now, no addict wants to be Narcaned in the middle of their high. That is not something any addict wants to do. It is not helpful. It doesn't make the high better. No. That's getting Narcan puts you immediately into withdrawal. Giving an addict Narcan while they're high, even if they're overdosing, watch most overdose people who get Narcan and see their reaction. They don't say thank you for saving me. They feel awful. They generally blame the person for giving them Narcan, right? Because they're all out of their minds. But they're not like, woohoo, now I can get high again. So I don't know why people believe this. Here's another one. If those fools want to kill themselves, being irresponsible, why go to all the trouble? The damn fools will just go right back out there and do it all again. Start giving drug dealers hard time that might slow it down, or the death penalty. Well, there's a lot of arguments that could be said about, punishing drug dealers. That's a different video. We need more deaths to lower the number of homeless addicts. Stupid people. I mean, when are these fools going to quit using? Don't get started. You won't end up dead or in prison. And I'm not reading anymore because... So the idea is this. If you're not a drug addict, before you open your mouth and start criticizing people who are, maybe have a greater understanding that'll help you have a little empathy. No drug addict wants to be a drug addict. Most of us, if we could, would choose never to have picked up in the first place. But I can tell you that I didn't have a problem the first time I used drugs or the second time I used drugs. I didn't have the problem the first couple times I drank. That's not how this works. And to blame addicts for having a disease, again, I want to go back to what I said when we started this video. When you hear somebody has cancer, you hear somebody has lung cancer because they've been smoking cigarettes. Do you blame them? Do you say, why do they get chemo? That's their fault. They should die. Or you find out somebody has diabetes because they've been overeating. Well, why should we care about that? Or maybe somebody who's allergic to bees goes and plays in the park. Well, why would we give them an EpiPen? They should have made better choices. Those things all sound ridiculous. They all sound ridiculous. Nobody would ever say that. Not only do people not say that, but most people don't feel that way. So why is it that both addicts and not addicts tend to look at overdose deaths as, oh well, the shame and the heartache? If we want it to get better, we need to care. Why are we going to help people get clean if we don't care whether they live or die? Now, I know, as I said, I'm a bit emotional today because I'm going to a funeral, and so when you see people's responses like that, it's crushing. And it's one of the big reasons that I have a channel and I sit up here and I tell you guys that I am a drug addict. Now, I have over 6.5 years clean, but that doesn't change the fact that I am an addict. And I go out in my community and I talk to other people and I share my experience, because we can't just assume that drug addicts are worthless, bad people. A lot of them are when they're using. But you take away the drugs and you get them into recovery, and we have some incredible people. You have no idea how many people in your life that you know that are actually in recovery. It's a lot. It's a lot. People don't talk about it because they don't want you to discredit them simply because they're an addict. But anyway, I should stop. So tell me, what do you think is the harshest part about, what people say about drug addicts? Do you have any personal feelings about drug addicts? Are you a drug addict who has become numb to overdose deaths? Tell me your thoughts down in the comments. I don't delete comments. Even if they're not pleasant, I don't delete them. I ask to please share your real opinion, but just do it kindly. You're not going to get hate from me, and nor anybody else who watches my channel. We should have real conversations here. I know other channels say that, and then if you say the wrong thing, they delete your comment, they get snarky. That's not what my channel's about, and those of you who subscribe and have been here know that. I have no problem if you disagree with me. Let me know. We should be having conversations about this, and conversations about this may be hard, but that doesn't mean we should ignore them. So please, let me know how you feel for real. Again, no judgment. I want to know. If you can leave a like on this video if you enjoyed it. And if you're new to my channel, please subscribe. All of my content is about recovery and addiction, except for Wednesday nights where we do trivia, which is super fun. But yeah, I hope you guys all have a really, really great rest of the weekend. Bye, guys.